Hello, welcome to AMCI Saturday Study Session, or SSS. I'm Mrs. J, Curriculum Director here at AMCI, and I am delighted to present AMCI Lead Instructor Ms. Tamika, along with her guest. Without further ado, let's get started. Take it away, Ms. Tamika.
Good morning, coders. How you doing? Hey, Rasha, you open it up every Saturday for me. I sure appreciate that. Hey, Shalini, it is always a pleasure to join you, coders. Everybody got their beverage of choice, your favorite pens and paper. How you doing, Miss Natalie? All right, Renata. Hey, Sonia. Hey, Sharnita and Soma. Always a pleasure to have you guys. And you know what we're doing today, all right? We're going to work on some nervous eye and ear. I know you're ready, and I know you have done the work. And we're going to just, hang out a little bit today and get as much study time in as we possibly can. And I have got a very special young lady hanging out with me, okay? She and I intern together, all right? She knows what she's doing. I'm just going to let y'all know that. She, just like myself, we've been where you are. I am pleased to welcome my friend, Miss Tiffany. Come on, lady.
Good morning, coders. Thank you for having me. I'm so excited to be here with you guys this morning. I've heard a lot about you. Miss Tamika rocks. I know the class gonna be on fire today. Just grab your coffee, snacks, and water, and let's get coding. We're gonna make this a fun Saturday.
I appreciate you, Miss Tiffany. Hey, we definitely gonna do our best. Miss Natalie, you are just fine. You are not late. If you calling this late, then I'm really in trouble, okay? I think it's the southerner in me, all right? So, hey, again, a human eye and ear and nervous system, all right? So make sure you're ready. I know you are. I know you are. I'm telling you, Miss Natalie, if this is late for you, I am in trouble. I mean that too, all right? You guys already know our agenda. Hey, we're going to keep it laid back so that we can get a whole bunch of stuff in. I'm not going to layer on too much. We've done our introductions. I'm going to go over our copyright. But I want to remind you, remember those steps for solving that time scenario, okay? Remember that who, what, when, where, and how. All right. Don't throw all your basics out of the window. I'm always reminding you of those things that are foundational to good coding, excellent coding. Remember those keyword concepts? They help you to paint the picture, and then certain ones are going to be pivotal to point you in the right direction in order for you to choose the proper code. And those facts to remember, put those FTRs on the corresponding pages that they belong to. Again, checks and balances, they're like your roadmaps. All right. So we're going to hop to it because I've got a whole lot of stuff in store for you. All right. But first, this copyright, CPT copyright 2021, American Medical Association, all rights reserved. CPC is a registered trademark of the AAPC.
Miss
AAPC content
Tamika,
found.
Miss
Uh oh.
Tamika,
Yes,
we
ma'am.
can't see your screen.
Uh oh. Uh oh. Thank you, lady.
You welcome.
Look here, I'm looking at the little thing. Thank you. I'm glad you interrupted me because we're gonna start some scenarios and then they really gotta see. Okay. Thank you, Miss Tiffany. See, I told you she got my back, y'all. All right, CPC is a registered trademark of the AAPC. AAPC content found within this presentation is copyright of AAPC. Keyword concept FTR Chun AMCI Fab 7, AMCI ICD 10, Flip Tap are trademarks of AMCI. All right, don't forget at the end, we want to hear from you, coders. You know why that feedback is important. AMCI wants to continue to deliver quality classes for you deserving coders. It helps myself and Miss Tiffany to deliver quality content to you. No feedback means no good. Let us hear from you, all right? And one way we can do it is to show the proper screen, right? The shameful part is I have a secondary screen to be sure I'm showing what I need to. All right, we are about to jump to these time scenarios. You guys know how we do it. 2.5 minutes for each one. We're going to start with some neurology scenarios. Get that brain going, okay? All right, Miss Tiffany's going to come. She's going to read your answers first, followed by the scenario. All right, coders, let me see what you got.
All right, coders, let's get started. A 61850, B 61863, C 61867, and D 61870. A 55-year-old man presents with uncontrolled tremors that have become quite severe and are now disabling. A trial of deep brain stimulated electrode is recommended. The patient is placed head holder adapter for the frame. The scalp is excised, exposing the skull using a perforator to make a single blur hole 2.5 centimeters from the midline at the level of the coronal suture, exposing the door, and is punctured for access. The microelectrode recording and stimulation is done to target and reposition the electrodes to determine the best placement for the neurostimulator electrode. The neurostimulator electrode array is placed in the thymus and fastened into position with radiograph imaging, monitoring placement. The lead coil in a pocket under a galley, which is sutured closed, followed by the skin closure. What CPT code is reported? Coders, you have 2 minutes. You guys got this.
All right, coders, I see lots of good stuff in that chat. Way to do it. Way to do it. I'm loving it, loving it, loving it. And I think unanimous. You guys have gotten this thing. I really, really like what I see. Okay. All right. So here we go. All right. So our answer is C, and you guys got there lickety split. So I'm not going to spend too much time on this thing. I'm just going to walk it through and maybe even share something that you can remember for the next go around if you see something similar. So our keywords are 55-year-old man, uncontrolled tremors, and we have the scalp that's been incised with a single burr hole of 2.5 centimeters. We have the microelectrode recording, or the MER, a neurostimulator electrode array is placed in the thalamus. So we are starting here with code 61850. This is a twist drill or burr hole or holes for implantation of neurostimulator electrodes. We don't even have to keep on going, because already when we read here, twist drill or burr hole, okay, that burr hole, yeah, burr hole, okay, Cortical, that's it right there. That's the sticking point. We are looking for something that was positioned in the thalamus. So we're going to take that one off. All right. So we're in the wrong position with that. Okay. We're going to continue on with code 61863. All right. Twist burr hole. Okay. But this one is talking about what? The subcortical site without the use of intraoperative microelectrodes. We were going pretty good until we hit right there without the use of that microelectrode recording. And we, in fact, we used it in this scenario. So we're going to take 61863 off the board. We keep on going and we get down here to 61867. All right, yeah, we've got that twist or burr hole. That looks good. Subcortical, meaning thalamus, with the use of this intraoperative microelectrode. So we're going to give that a light yes. We've got to do our due diligence and check out our last code of 61870. This is craniectomy for implantation of this neurostimulator electrode, cerebellar or cortical. That's the wrong procedure. And hey, that's not going to do, and the wrong spot. So it's wrong 2 times over. And indeed, 61867, that was the spot. All of those perfect keywords in there. Yeah, you guys were spot on. I love what I see. I don't think anybody needs a screenshot of that one. So we are going to come on and keep on going. Thank you for that, Miss Natalie. She's letting me know that 61870 has been deleted. I appreciate that. You guys know I go back and forth between my other 2 books, okay? I just didn't have the heart to change this thing, all right? So this one right here, though, it's still good, all right? So we're going to keep on rolling. And this here, you know, I always want to give you a little tidbit that this MEA or microelectrode array, what it is, they're devices that contain these multiple microelectrodes, and you have neural signals that are obtained or delivered through those, okay? And so they interface and they connect neurons to electronic circuitry. All right, we're going to head on to the next one. You guys are rolling. I think we're going to get through quite a few today. All right, Miss Tiffany, you got the floor. I don't hear you, Miss Tiffany.
Can you hear me now?
I can hear you now.
I had it on double mute. I apologize, Ms. Tamika and coders. All right, let's get this thing sorted. A, 62350, C, 70.0, B, 62362, C, 70.1, C, 62360, and C, 70.0, D, 62367, and C, 70.1, 70.1. A patient has a malignant neoplasm of the spinal meninges, is receiving a programmable pump implantation for chemotherapy. The patient is placed in the prone position, where the provider made a midline incision overlying the area of the spinal cord. The reservoir was placed in the subcutaneous tissue and attached to the previously placed catheter. Layered sutures were used to close the incision. The patient tolerated the procedure well and was released in good condition. What CPT code and ICD-10 codes are reported for this procedure? And coders, you have 2 minutes.
All right, guys, I've got my clock tinging and clicking and everything else back there, okay? All right, so a lot of you got there. I like what I'm seeing. Really, really good job on this one, guys. Really nice job. We're going to go ahead and unpack it, okay? And if you just missed it, don't worry. We're going to brush it off for you and we're going to get you there, okay? So I saw some people were leaning more towards C than B. All right. So no worries. All right. We're going to get you there. Okay. So I'm just allowing the last few to come in here and then we're going to go ahead and talk about it. All right. So let's do it. All right. So your answer is B. So if you just missed it, like I said, we're going to get you there. All right. So our key words: malignant neoplasm, spinal meninges, programmable pump, implantation for chemotherapy. I'm certainly going to try to make it an aha moment, Renata. Our additional keywords are prone, in the patient's in the prone position. This provider is making this midline incision over the spinal cord area. One thing I want to bring your attention to with this particular one is in all of your codes, pay attention to where you are. Use these various headings to be sure you're in the right neighborhood, okay? So we're looking for a programmable pump, all right? And it's being implanted. If you're in this section, this is talking about a catheter implantation. Well, here, implantation, yeah, okay. But this is for a revision or repositioning of a tunneled intrathecal or epidural catheter. Again, we're dealing with a pump. So 62350, that's no good. We get down here, yeah, now we're in the right neighborhood, all right? Reservoir pump implantation. That's what we're looking for. We are having a pump that's being implanted for this particular patient. So we start with 62360. This is implantation or replacement of device for intrathecal or epidural drug infusion, subcutaneous reservoir drug infusion, chemotherapy. Yeah, and this is indeed a pump. All right. This right here is what's not good. Subcutaneous reservoir. So the common code language, remember, I always tell you, pay attention to that because everything before this semicolon is good, but this code language after the semicolon that's specific for code 62360, that's what makes that one incorrect. All right. So we're going to take that one away. Now, we're still going to take a look now, though, at this code family. When we look here at 62362, all right, this is implantation or replacement of device or epidural drug infusion, okay? Programmable pump. Yeah, you saw how I made that jump out at you. Programmable pump. I like that. We're going to give that a light yes. We're going to take a look down here for do our due diligence. Let's see. 62367. This is electronic analysis of programmable implantable pump. We already know that's no good. Okay. Yeah. So we're going to take that one away. You know, we don't have to go through all of these things because, like I tell you, once you get the proper code here, don't start fumbling around with that ICD-10 manual, okay? If you don't have a tie to break with these CPT codes, stay out of this book until you just have to. Spinal meninges, yeah, that's where we need to be. And we already know C70.1, that's the code for that. But yeah, 62362, that's where we need to be. All right. And so now you know if you chose C, yeah, you were on the right track, but right there, okay, the code language that was specific for this code was no good. All right, we needed this programmable pump, all that other stuff applied. So don't get lost in the code reading. Pay attention to what's coming after the semicolon. Does it apply? All right. I see some guidance. Okay. All right. So if you need a screenshot, grab it. And we're going to keep on going. We got some work to do. Yeah, pay attention to those headings and subheadings, guys. All right, here we go. All right, Miss Tiffany, you've got the floor, lady.
All right, Ms. Tamika. A, 63050, M50.21, B, 63020, M50.21, C, 63020, 63035, M50.91, D, 63050, and M50.91. A patient with a herniated cervical disc undergoes a cervical laminotomy with partial fascectomy, and excisional of the herniated disc for cervical interspace C3 through C4. What CPT code and ICD-10 codes are reported? Sorry about the pronunciation, coders. You have 2 minutes.
All right, coders, I think I've seen everybody's answers in there. If you hadn't got it in there, go ahead and slide it in there. I like what I'm seeing. I see y'all coders. Y'all are bringing the heat and you got the magic this morning. I like it. All right, so we're going to go ahead and take a look at it. And your answer is indeed B. I saw some folks were kind of teetering between B and I saw a few D's in there and some C's, but I think you guys got it. And I think we just need to just go over what that interspace is, just to remind you guys. All right. So make a note of it in your book so you're not going back and forth. All right. But you guys are doing outstanding. That's right, Natalie. So it's that interspace. That was always a thing for me. And I still make notes of it in my book so that I don't lose track. All right. So our keywords: herniated cervical disc. They're having a cervical laminotomy and partial fascectomy with excision of this herniated disc for cervical interspace C3 and C4. All right, so you know I can't resist just a little bit of anatomy. All right, the interspace, that is that cushion between the disc, and the segment is the disc or the vertebral bone. All right, so you want to remember that. That will keep you straight every time. All right, so 63050. Nobody took the bait on that one because that's a laminoplasty and we're having a laminotomy. This is repairing the lamina. This is indeed making an incision into the lamina. So we're going to take 63050. That one's gone. All right, incorrect procedure. And y'all know I love a good deal. That's some good couponing right there. We got 2 for 1. We're at 50-50. So we've got to choose correctly because this is going to put us on the right path. All right, so we take a look here. This is the same code in both. 63020. This is for laminotomy. We had that with decompression of the nerve root or roots, including a partial facetectomy, foraminotomy, and or excision of herniated intervertebral disc. One interspace. One interspace. That's the key word. Yeah. And that's what we're dealing with. Yeah, laminotomy. Yeah, you know I like to make those pop out at you. Partial facetectomy, herniated cervical disc. I mean, it's like verbatim. Is it one interspace in the cervical area? Well, we're going to see. Cervical interspace C3 through C4. C3 through C4. We have 2 segments or 2 discs, but 1 interspace. Okay, we've got several keywords here, but we're going to take a look at this add-on code for 63035. This is for each additional interspace, cervical or lumbar. So this is what this was testing you on. Knowing the difference between an interspace and a segment, and indeed we're looking for an interspace. So we don't need 63035. No additional interspaces are needed. We have only one interspace and 2 segments or vertebral disc. You know, this is just for completeness sake that ICD-10 CM code M50.21, other cervical disc displacement, high cervical region. Yeah, we're right where we should be. So B is your answer. Okay, so if you need a screenshot, you can get it. I like that, Shalini. I like that. Yeah, best way to remember. Shalini remembers the best way to remember is fingers and segments, and the interspace is that area between the fingers. All right, so hey, I think that's an excellent visual. Okay, all right, guys, we're gonna keep it moving and head on to this next one. All right, Miss Tiffany, you have the floor.
All right, let's keep this magic going. Like Miss Tamika said, you guys are doing so great. A 60520, B 60521, C 60522, D 60540. The provider removes the thymus gland in a 27-year-old female with myasthenia gravis. Using a transcervical approach, the blood supplies to the thymus is divided and the thymus is dissected free from the pericardium and the thymus is removed. What CPT code is reported for this procedure? And Coda, you know what time it is. You have 2 minutes.
All right, guys, if you hadn't gotten your answers in there, go ahead and pop them in there. I see some great keywords from you guys this morning as well. So, hey, obvious. It's quite evident that you guys are putting in the time and the work, and I love it. Love it, love it, love it. You guys are you rounding the corner. You're rounding the corner, and I can see you getting ready for this exam, okay? So, yeah, the answer is A. All right. So I had a few outliers, but no worries. We're gonna brush this thing off, all right? Because anybody that didn't quite get there was real close, but you guys did just amazing. So yeah, the answer is A. Y'all are ready for this thing. So your keywords, I saw many of you use them. The provider is removing the thymus gland in this 27-year-old female with myasthenia gravis, and they're using a transcervical approach. The thymus has been dissected free and removed. So what code are we going to use? Well, we're going to take a look at 60520. This is for a thymectomy, partial or total. All right. Well, the thymus was removed. All right. That would be a thymectomy. Transcervical approach. Well, yeah, transcervical approach. Yeah, that's looking real good. We're going to give that a light yes. Before we commit to it, we've got to do our due diligence, see what else is in store for us. All right. Okay. So still under the same code family, thymectomy partial or total, but this is for sternal split or transthoracic approach. We already said it's transcervical, so boom, that's gone. Incorrect approach with that one. 60522, this is for thymectomy again, partial or total, but this is involving a sternal split or transthoracic approach, but we need transcervical, so the approach is incorrect with that one as well. Okay, and we're going to keep on going. And this is all off. This is for an adrenalectomy. We're removing a totally different organ. We're removing the adrenal. Okay, so 60540, that's incorrect. Okay, so hey, that's why and how you guys got to 60520 for A. I like what I see. I like what I see. And so if you did choose 60521, okay, now you see 60521. Now you see, yeah, you were getting close right there, but pay attention. This was transcervical. This right here is coding for transthoracic. So the approach was incorrect. Okay. So you guys were spot on. We're going to keep it moving. Let's do this, Miss Tiffany. She's ready. Look, I think that they are firing off some brain cells. Yeah, I can see it. You guys are getting one chapter, one code at a time, one step closer to that CPC. Hey, y'all. All right, Miss Tiffany, you have the floor.
All right, coders, let's keep it rolling. A 61521, B 61524, C 61598, 61616, modify 51, and D 61597, 61616, modify 51. A 50-year-old male is diagnosed with a tumor of the skull base just below the occipital tonsil. The neurosurgeon performed a transpectoral approach to the posterior cranial fossa, and then he performs an intradural removal of the tumor of the posterior cranial fossa at the base of the skull. The dual repair is done and the area is closed with the neuron. What CPT codes is or are reported? Coders, you have 2 minutes.
All right, coders, I see y'all. I see y'all. Look, what? What? Y'all are some pros. I see y'all in there. I see keywords rolling in. Yeah, that's right, Miss Tiffany. They are doing awesome. I see y'all in there. All right, well, we're going to go ahead. You guys really unpack this. I can tell, Rasha, this is your favorite system. You got to make this one of your go-to sections on that exam. All right, so here we go. We've got answer C. You guys got there. I saw just a few A's, okay? And that's okay. I think you guys got nudged in the right direction. So I'm just definitely going to pivot to answer A as to why we won't pick that one. And I can tell when you're in between two, because you'll put one and then as soon as we tell you take one more look, boom, you got the right answer. Okay, so yeah, that's right, make it part of the master 7. That's right, Renata. All right, so we're looking at what is the approach. We've got those FTRs right here, and I know you guys have them on the page. Okay, these are pivotal with these particular codes. So for our keywords, we've got this 50-year-old. They have a tumor of the skull base. The neurosurgeon is taking the transpetrosal approach to the posterior cranial fossa, and we have an intradural removal of the tumor of the posterior cranial fossa at the base of the skull, and they're also having a dual repair. A lot of stuff going on, but we're going to focus in on the transpetrosal approach, the posterior cranial fossa, okay? Because we're taking a look at these FTRs. What is the approach? Okay, it's the transposterior approach. Is this intradural? Is it extradural? We know we've got intradural. It's an intradural removal, okay, at the base. So there we go. And the approach and the definitive procedures should match. All right, there we go. Posterior cranial fossa, posterior cranial fossa. So we're going to take a look at how we got to C. Again, always take a look at these headings. This is for a craniotomy or craniectomy. All right. Well, so for 61518, all right, and this code up under it, 61521, this is craniectomy, midline tumor at the base of the skull. Yeah, they're trying to fake you out with that base of the skull, but we know that we are coding for a skull base removal. All right, so 61524 for excision or fenestration of the cyst. We know none of that was going on, and it's in the wrong section. Okay, so we're going to take that away because we are indeed dealing with surgery of the skull base. So again, allow these headings to help you to navigate to the right area of your code book, or as I say, get in the right neighborhood. All right, so here we go. Surgery of the skull base. Yeah, that's what they're having. They've got a tumor of the skull base, so that's what we're dealing with. Posterior cranial fossa, posterior cranial fossa. We're taking a look at the approach procedures. Well, this is transcondylar far lateral approach. What was our approach? It was transpetrosal. All right. Yeah. So yeah, you know I like to make those things jump out at you. So 61597, that's no good. Yeah, transpetrosal approach for the posterior cranial fossa. That's spot on. You know I'm going to give you the definitive procedure because those things should match. All right. So code 61616, resection of excision or excision of neoplastic vascular infectious lesion intradural. All right, and there we go. Intradural removal of the tumor, 61616. There we go. And we have this 51 modifier because when you have one surgeon that performs more than one of the procedures, then both of those are recorded, and we add modifier 51. How do we know that? It said he then performs. So he's doing both. All right, so that's what got us with that modifier as well. And there we go with C. So I want you guys, again, use these headings because as soon as you get here and you compare the two, if you're not sure, take a look at where these codes are falling, because once we get here, remember I tell you, if that parent common code language is incorrect, everything before the semicolon, if it's incorrect, that common code language in that parent, everything that falls underneath it, it would be incorrect as well. So once you understand you're in the wrong area, you know you could immediately get rid of these. So again, allow these headings to guide you. Then we get here and then we start to unpack it. And that's pretty simple when we start looking at the approach. If all these words start to get you going, just take a look at what am I looking at? We're looking at the approach. So you start just matching it up, okay? So you guys are doing fantastic, all right? So you know I'm gonna keep reminding you because I gotta see your name up on that board, all right? You ready for just a little bit more? I'm gonna give you one more and then we're gonna jump to some eye and ear stuff, okay? All right, Miss Tiffany, you got the floor, lady.
All right, coders. A 63087 modified 52, 63088 modified 52 times 2, B 63085 modified 62, 63086 modified 62 times 2, C 63087 modified 80, 63088 modified 80 times 2, and D 63085, 63086 82 modifier times 2. A 47-year-old female presents to the OR for a partial corpectomy to 3 thoracic vertebrae. One surgeon performs a transthoracic approach, while the other surgeon performs the 3 vertebrae nerve root decompression necessary. How should each provider involved code their portion of the surgery? Coders, you have 2 minutes.
All right, coders, how we doing in there? I think I've got everybody's answers in there. Yeah, I see somebody sliding that last one in there. Yeah, I can, like I said, I can always tell when you guys are teetering if we give you a little nudge and then immediately you go and you find that right answer and you get it. All right. So hey, we're gonna go ahead and unpack this one. And some of you got there really, really quick. And I like to say that for those of you who did, you found the secret sauce. Yes, you did. You found the secret sauce, y'all. The secret sauce. All right, so here we go. Natalie said, yes, yes. Those modifiers, I'm telling you, y'all, they're magic. That's the secret sauce right there. All right, so somebody told me they ain't even have to check the book. Didn't even have to check the book, okay? I love it when it's like that, y'all. You know I do. All right, so we've got this 47-year-old. They've had this partial corpectomy to 3 thoracic vertebrae. One surgeon is performing this, okay? Performs this thoracic approach, while another surgeon performs the 3 vertebral nerve root decompressions. Each provider involved has to code their portion of the surgery. As soon as you see that, what do you start thinking? Yeah, the answer is B, but what do you start thinking if we've got a code for each one of them? And each one of them is coding their portion of the surgery. We know we're going to need a modifier. So really, really for testing purposes, you just need to be clear on those modifiers. That's right, guys. You just need to be clear on the modifiers. So how would you have arrived at that thing quickly? Check those modifiers. Eliminate those wrong answers. For these codes in this particular scenario, you have your guidelines. They state that when 2 surgeons work together as primary surgeons performing distinct parts of spinal cord exploration or decompression, each surgeon reports his or her distinct operative work by appending what? 62. That's all I'm looking for, particularly because every last one of these modifiers is different. So boom, you get there in less than 30 seconds. Less than 30 seconds, and one of you did, okay? A couple of you did, really. All right, so just remember that, all right? Because that'll help to buy you some time on some other scenarios that might require a little bit more of your time. Yeah, that 62 right there, that was magic. Yeah, that was the secret sauce, but you know I'm going to unpack it anyway. So we have here, they've gone to the OR for this partial corpectomy, and then the other surgeon is performing the nerve root decompression. So we start with code 63087. This is for vertebral corpectomy, vertebral body resection. All right. This is using the thoracolumbar approach, and this is the transthoracic approach which was used. So we can go ahead and take off 63087. And that's in 2 of them, y'all. We couponing again. We got 2 for 1. All right. So we take a look now at 63085 because really that's all we've got. All right. So again, I always tell you guys, take a look at that lead code. You might have 4 choices, but you might only have 2 different codes you're working with. Sometimes you might only have 1 lead code, and it's a matter of they might all be the same. You go to the next one, or it could be the difference of modifiers. So 63085, vertebral corpectomy. Yeah, we saw that. All right. Partial or complete transthoracic approach. We know we're in the right area. Thoracic single segment. Okay. Yeah, look at there. All that stuff. I like to make it just jump out at you. One surgeon performed that. All right. And we've got that single segment. All right. And then thoracic, each additional segment. All right. So we have 3. All right. So we're going to need that add-on code of 63086. Now, it was a matter of the modifier because everything was matching. All right, we had this 82 here, but we needed that 62. And this is just telling us with this parenthetical guideline that, yeah, we're on the right track. Use this, in fact, in conjunction with that. That wasn't an issue. It was a matter of understanding that modifier that needed to be there. Okay, this 82 is for an assistant surgeon, and no, these surgeons were each performing their own particular portion of that exam. They're working together with this primary. They're both serving as primary surgeons for their distinct portion of the exam. And when you read here of the surgery, so when you read here, it's telling you we're spot on. All right, so we're reporting that 62, and y'all understood that. All right, each provider. All right, that was key as well. All right, we're going to keep it moving, and yeah, modifiers. That was a secret sauce. Okay, so we're going to keep on going. We got to get some ears in. We got to get some auditory coding in. I got a sneaky suspicion y'all are ready. Depending on how long it takes you guys to move through auditory and I have some additional neuro coding scenarios. So don't worry. I always keep a whole lot of junk in the trunk. All right, come on, Miss Tiffany.
All right, Miss Tamika, let's get it started. A 69205, B 69220, C 69200, and D 69210. What CPT code is reported for removal foreign body from the external auditory canal without general anesthesia? Coders, you have 2 minutes.
All right, coders, I see lots of stuff in there. I'm loving it. I am loving it. Oh man, Natalie's getting some snow. We've just got like some rain going on, some rain going on. So hey, you're inside. Hopefully you don't have to get out in it. So hey, that will work as long as you don't have to get out there sloshing in the snow. So hey, we're gonna try to make it warm and fun on the inside. All right. So you guys already know how to do this thing. You guys got there with C. I'm loving it. So I'm not going to spend too much time because, like I said, I want to unpack a whole lot of stuff today. So you guys already saw removal of this foreign body from the external auditory canal without general anesthesia. So we know we're in the right neighborhood. We're up there with removal. 69210. That's indeed for removal of impacted cerumen. So no, we're looking for foreign body removal. And I imagine that this person is probably a small person because I remember when my kids were small. I don't know about you, but my youngest, yeah, she was working with a Cheerio in the nose. So yeah, yeah. But you know, me being the the mama that I am, I got it out myself. So here we go. We've got 69220. This is for debridement. We know we're not even close with that. We are looking to remove this foreign body from the external auditory canal. All right. So here we go. 69200. Removal of the foreign body from the external auditory canal. That's verbatim without general anesthesia. Yeah, I love that thing. I do. Look at there. Perfect. We're going to give that a like. Yes, do our due diligence and take a look at its cousin beneath with general anesthesia. We already said without. So we already know that wasn't it. And you guys got there in no time. And yeah, use these type of different scenarios to, again, get you some time. All right, get you some time built in so that you can use that extra time that you got for some things that might take a little bit more brain power. And you know, I'm always going to sneak just a little bit of chun in there. So I know you've got those books chunned. Okay, so I'm always telling you real estate is very limited. So be very precise with your chunning. You know, something as simple as foreign body, impacted cerumen, debridement. So you can see when you start looking there, boom, 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 I'm looking for foreign body. This is the one I need to take a closer look to. All right. All right, we're going to keep on going. All right, Miss Tiffany, go ahead, lady, go ahead. We got them pumped. Everybody's raising their hands in the air. with their
Yes,
pencils in
they
them, of
are.
course. All right, guys, after she finishes, you know the drill. You'll have 2.5 minutes. You have the floor, lady.
All right. A, 69300 times 2. B, 69300 modified 50. C, 69310 modified 50. And D, 69120 modified 22. A 6-year-old female with prominent ears undergoes a bilateral otoplasty. Surgeons make an incision just behind the ear in the natural fold where the ear is joined to the head, exposing the cartilage. The cartilage is trimmed and shaped, and the incision is closed. Temporary sutures are placed to secure the ear until the healing is accomplished. The procedure is repeated on the other ear. What CPT code is reported?
All right, coders, I think I have just about heard from you guys. If you hadn't got that answer in there, go ahead and slide it in. But it looks like most of you have. And if you have, I'm gonna go ahead and start talking about this thing. There we go. I got my last answer in there. See, I told y'all, Miss Tiffany and I, we see you. We really do see you in there, okay? All right, so we'll go ahead. Yeah, it was unanimous straight across the board. It's straight across the board. Miss Tiffany can attest to that. I'm telling y'all, we're gonna have to put them out, Miss Tiffany. They on fire. We gotta put them out today. All right, that's what I'm talking about. Here we go. B 69300 with that 50 modifier. Yeah, you guys are on fire. So I'm not going to take much time at all. This is a 6-year-old female. She's got some prominent ears. They're going to go ahead and pin those ears back with a bilateral autoplasty. All right. And so the surgeon is going to make this incision. That cartilage is going to be trimmed and shaped. All right. And then he's going to repeat the procedure on the other ear. See, that's my timer. And see, y'all didn't even need it. Y'all didn't need that. All right. So 69110. All right, this is for excision external ear. We're coding for a bilateral autoplasty. Complete amputation. No, no, no. We know we are not in the right spot. All right, so 69120. We're going to take that one away. We're going to come on down here and take a look here at this heading. We're talking about a repair. Yeah, and we see here autoplasty. That's repair, bilateral repair of the ear. So we know we're on the right track. So 69310. This is reconstruction, okay, of external auditory canal. Meatoplasty. No, no, no. Yeah, we got the plasty part right, but yeah, we're at the wrong spot. This is for external auditory canal. We're talking about bilateral autoplasty with the outside of the ear. So we're going to take that one off. But here we go. This is spot on. Autoplasty protrude ear. It's even giving us a bit of the description with or without size reduction. Yeah, we know we're in the right spot, but the issue was, did we need a ×2 or 50 modifier? And indeed, that's when your parenthetical guidelines rule. Prominent ears, protruding ears. Yeah, repeat it on the other ear. Bilateral procedure is telling you we're going to need that 50. So we knew to take that one away and code for 69300 with indeed a 50 modifier. I love it, y'all. We're going to keep on going. We're going to keep on going, y'all. All right, Miss Tiffany, you got the floor, lady.
All right, coders, let's get to it. A 69799, B 69667, C 69714, D 69710. A patient with severe mixed hearing loss from chronic otitis media undergoes round window implant with floating mass transducer. What CPT code is reported for this procedure? 2 minutes, coders.
All right, coders, I see those answers in there. I see them. I see them. Wonderful job. Just beautiful. And I mean it when I say, yeah, that CPT coding thing, it looks good on your coders. I see y'all in there. Hey, if you just missed it, that's okay. These particular scenarios used to drive me nuts when I was a student. I was just like, really, I'm gonna really need it to have a code. I'm gonna really need it to have a code. Okay. So here we go. The answer is A, this 69799. You ever wondered when you would ever need it? Well, this is one of those times that you do. So here we go. How did we get there? This patient has severe mixed hearing loss from chronic otitis media. They're going to undergo a round window implant with a floating mass transducer. So we take a look at 69667. This is indeed for a repair, the round window. All right. But what's happening is we are having an implant. Okay, we're just really sticking with just matching up those keywords and being confident that in what we see or don't see, that that indeed applies. So yeah, it's not a repair, it's an implant, okay, that's being involved with the round window. So we take that one away. Then we take a look at 69710. This is implantation or replacement, but this is of electronic electromagnetic bone conduction hearing device. This is with a floating mass transducer. Again, we're just simply matching up the keywords, and this does not fit the bill. So 69710 is off the board. This is coding again, electromagnetic bone conduction hearing device. We need this floating mass transducer. And 69714, this is implantation of an osseo-integrated implant. All right, that's not what's happening. Again, it's that floating mass transducer. So indeed, the nice thing about this 69799 is unlisted, but it's involving the middle ear. And we know chronic otitis media is where it's occurring in the middle ears, inflammation of the middle ear, chronic inflammation. All right. So yeah, we know we're at least we got that. We know we're coding for something that's involving the middle ear, but the procedure itself is specifically not listed. So 69799, that fits the bill. All right, guys, we're gonna keep it moving. They're ready. They're ready. We're gonna move on to some eyes and sprinkle a little of this in there. And like I said, if we still have time, I've got some more neuro for you. Like I said, y'all know I travel heavy. I travel heavy. Lots of junk in the trunk. So we've got each eye that has 6 muscles. This is on page 495 of your 2021 CPT manual. So you want to remember these vertical muscles. All right. So your superior rectus muscle and the inferior rectus muscles, those are your vertical muscles of the eye, and the superior and inferior oblique muscles are your vertical muscles. Okay, the horizontal muscles, they involve the lateral and medial rectus muscles. Be sure you have this notated on the diagram in your book to help keep you straight. Like I always tell you, leave nothing on the table. Remember to watch for the operating microscope. You're going to need this add-on code of 69990 when it applies, but you want to check carefully the code language and the parenthetical guidelines prior to using that code always. Okay. All right. So here's our next scenario, and the lovely Miss Tiffany is going to come and read us out, and then you'll have 2.5 minutes. You've got the floor, young lady.
All right, coders, you guys are doing good. Miss Tamika got plenty junk in her trunk. No light packing over here. We headed heavy hitters. Let's get it started. A 67901, B 67903, C 67906, and D 67908. The patient was taken to the operating room. The provider everts the upper eyelid and places clamps across the everted undersurface of the upper eyelid. The tissue distal to the clamps is excised or resected. This tissue includes conjunctiva, tarsus, Muller's muscle, and the distal insertion of the levator aponeurosis. The remaining tissue is reattached and sutured. What CPT code is reported? 2 minutes, coders.
I see these answers rolling in. I think I've heard from everybody. If you want to get your answer in there, I'm not even going to say if you want to. You know, I always say I need your answer in there, regardless of what you're thinking. This is where you're brushing off, fine tuning it, brushing off a little bit of dust if it's on there, okay? You guys are doing outstanding. And I want to remind you, I don't need no sorries in that chat, okay? This is study group. This is where you need to get clear. This is where you get clarity and you help yourself to really fine tune and hone in on some things that maybe you're not sure of. I want you asking them. And that's why I always tell you, regardless of what you thinking is the answer, if you're not sure, put what you think it is, because that helps me to really guide where I need to focus. Okay. But I love it when everybody gets it right as well, because I'm still going to just go through, give you a walkthrough, maybe shed something, that you can use, that you can write in your book if you need it for future reference. So no worries. Okay. I hope you guys feel very comfortable when you're here with me. I want to, again, help you to do what you need to do to pass the exam. So everybody just continue to just relax and just really engage with us. It means the world to me that you're here and you're working on what you need to do. Okay. So I don't need no sorries. I don't want to hear that. We family here. Okay. All right. So here we go. All right. So I'm not going to spend much time. Y'all got there. And a few of you, if you missed it, you caught it and just needed a little nudge. So I'm not going to spend much time because I want to get on to some more stuff. I always like to give you stuff where you need, it's a little meaty, where you need your knife and fork. So here we go. We've got this patient. They've gone to the operating room and now they've elevated the undersurface of this upper eyelid and they've excised with the clamp. They have excised or resected this tissue, and the tissue includes the conjunctiva, the tarsus, the Mueller's muscle, and the levator aponeurosis. So we have for code 67901 repair of blepharophytosis. Blepharophytosis. Boy, oh boy. All right. This is for drooping of the eyelids. I just need them to say drooping of the eyelids. But, if you want to get technical, it is blepharophytosis. That's it. Blepharophytosis. All right. So this is involving the frontalis muscle technique. Yeah, this is what's happening. They are repairing this drooping eyelid, but this technique, okay, that's the issue. So 67901 is incorrect. We continue on because we're going to stay within this code family. So we're just looking for the proper technique. All right, this is involving tarso-levator resection or advancement internal approach. No, no, no. So with that approach, that one's incorrect. Okay. We're coming on down here. Superior rectus technique with fascial sling. We didn't have anything mentioned of that. Again, I love when we're simply just making sure we understand keywords and matching them up according to these codes. And here we go. Conjunctivo, tarso, Mueller's muscle, levator resection. All right. Yeah. Mueller's muscle conjunctival resection, or MMCR. That's a what? A blepharophytosis repair. So we know we're right where we need to be. Look at there. All of that stuff matching. All right. Yeah. 3 keywords match. I think we are right on the money. Okay. So there we go. We're going to keep it moving, coders. Y'all are doing it. All right. Look here. You know what, Miss Tiffany? I think they're ready. If I had a test now, we need to pass them out. We need to pass them out. Y'all
We
are on
need to
your
pass
way.
them out, Mr. Mika. That's right.
That's right. That's right. Here we go. You have the floor, Miss Tiffany.
All right, coders. A 67229 modified 50. B 67229 times 5. C 67229 69990. And D 67229. An infant born at 33 weeks underwent 5 photocoagulation treatments to both eyes due to retinopathy or prematurity at 6 months of age. The physician used an operating microscope during these procedures. These treatments occurred once per day for a defined treatment period of 5 days. How would you report all of these services? Coders, you have 2 minutes.
All right, guys, that's my clock going off. All right, so we were just finishing up in that chat. I always like to make sure we can address you guys, and I always appreciate Miss Tiffany in there. So hey, you get double the encouragement, all right, double the love. Hey, you can never get enough responses in that chat. We want you guys to know we're here with you. We are rooting for you. So here we go. I'm going to try to make this an aha moment for you if you need one. I had just a few people were kind of stuck. They were like, I don't know, is it A or C? I don't want to choose. So we're going to get you there because on the exam, I'm going to need you to be able to give yourself that little nudge so you can break that tie and you can break it confidently. Okay. So our keywords, this infant, they've undergone 5 photocoagulation treatments to both their eyes due to retinopathy of prematurity. All right, and so now we've got this operating microscope. It's being used once per day for a defined treatment period of 5 days. All right, so how could you get to the answer in less than a minute? I know y'all are like, what? Okay, you might be doing the Arnold on me. What you talking about, Willis? What are you talking about? Yeah, you could. We'll tell you, both eyes. Okay, so if we're dealing with both eyes, you read the parenthetical guidelines because here's one of those instances. It's only one code. And so it's a matter of what's happening with that code, what's being added to it, what additional code is being used. Yeah, read the parenthetical guidelines. For a bilateral procedure, you're going to use modifier 50. Okay. All right. So how do we do that? The answer's A. Okay. We need this modifier 50. So I'm gonna walk you through. I'm gonna walk you through. So we've got 67229, and that's not the problem because that's in all of them. This is for this treatment of extensive or progressive retinopathy, 1 or more sessions. Well, how many sessions did we have? Okay, we had how many? We've got 5 days. All right, so here we have here for destruction. These codes should be reported only once during a defined treatment period. Okay, so if that's the case, once per day for a defined treatment period of 5 days. If that's the case, and this patient has been treated for 5 days, no matter how many times they've been treated, we can only use this code once. So already we can take B away. We're not going to use a multiplier. Just that one code is enough for a defined treatment period. All right. So that took that away. Again, same code, but what's being added to it is the issue. All right, so here we have for operating microscope. We need to take a look at this. Do not report 69990 in addition to procedures where use of the operating microscope is an inclusive component. All right, so here, look at that code range right there. Okay, we have 65091 through 68850. Right? Does our code fall within that range? Well, it sure does. It sure does. So we're going to take that one away. All right. So we're not coding for it. Yeah. And that box, which box are you asking me, Kiara? You're going to look at the code, the page that this code falls on. This is where you're going to find this verbiage for this add-on code. You're going to have to go and look at 69990. Look there at the page and it'll give you these codes that follow, okay, are the ones you would not use this code for, okay? All right. Thank you, Natalie. It's on 508, Kiara, okay? Yep. All right. So once we get that, we're going to take that one away. And now we're left here. So now it's a matter of, do we need a 50? Look at there. Remember the parenthetical guidelines. They rule. Yeah, for both eyes. For bilateral procedure, use modifier 50 with these codes that follow. And boom, there's our code right there. 67229. Okay, so this one goes away and that one stays. Okay. All right. So how you doing, coders? I think you guys are doing good. Like I said, most of you got there, and then I had a little bit of a split between the A and C. So it's a matter of your parenthetical guidelines and understanding when you do and do not use this operating scope. So make yourself a list here because this used to get me this here. What you need to do, I put on the side in my book, do not use with these codes. Okay. I sure hope it's an aha moment. If you guys were teetering, like I said, I saw some C's in there. So yeah. Okay. Let's see, Kira, I'll dig through my book and look for you. Let me know what part you're not seeing, and then I will yeah, I know a flashlight would be great, Natalie, for the parenthetical guidelines. Make sure you guys box this. And then as we move along to the next one, Kiara, I'll dig around in my book and I'll give you the specific area. Okay. All right. Oh, the defined treatment. I will find it. I'm sure it's like in the verbiage that's leading up to that area. So I'll dig it through. Okay. All right. So here we go, coders. All right, you got the floor, Miss Tiffany. Then you'll have 2.5 minutes.
All right, coders. A, 67916 modify 50. B, 67916 E4 modifier and 67914 E2 modifier. C, 67914 modify 50. And D, 67923 E modifier 4, 67921 E2 modifier. A 65-year-old patient presents with ectropion to the right lower eyelid. Repair with tarsal wedge excision is performed for correction. Attention was then directed to the left eye. The patient also had ectropion on the left lower lid, which was repaired by suture repair. Code this procedure.
All right, so here we go. I'm muted, y'all. So here we go. All right, let's go ahead and unpack it. We've got this 65-year-old with an ectropion of the right lower eyelid. They're having a repair with a tarsal wedge excision, and then they're also going to have attention directed to that left eye for an ectropion of the left lower lid, and they're going to have a suture repair there. All right, so we just got to really just take our time and be sure we're coding the proper eye with the proper um, procedure. That's really all we're doing here. All right, and understanding, do we need a 50 or do we need specific modifiers for each eye? Our answer is B. Yeah, and you guys were getting there. Okay, some of you needed to just shine it up just a little bit and needed a little nudge, but hey, no problem. I'm glad to see these answers in here, and that's really encouraging for you, and hey, it's encouraging to me to see it. I see your growth every week. So we're going to take a look here. We've got E2 for that left uh, lower eyelid, and for the right lower eyelid, it's E4. All right, so we already know that. All right, so although bilateral, a different procedure is performed for each eye. So we're going to need to have the modifier that's specific for that. All right, and so always remember, if you're toying with which one do I need, okay, if it doesn't give you anything in the parenthetical guidelines as far as is it a do we only use 50 or whatever, then you're going to use that particular modifier in this case that's specific for each eye. Remember, going back to part 1, you want a code to provide a certainty and specificity. Okay. All right. So we're going to go ahead and we're going to take 50 away, okay, because we have different eyes. And we know with this section with the eyes, be aware of whether or not you're going to use a specific modifier or if it's 50, okay? Just pay attention as always, your guidelines. So here we have repair of entropion. Well, we already know with both eyes, it is an ectropion that is present on the lower eyelids. So we're going to take this one away. Yeah, that's ectropion. All right. So this is for excision of tarsal wedge. That's correct, but not for an entropion. All right. So we're going to take 67923. We take that one away, and already we are right where we need to be. All right. So we have repair of ectropion suture. All right. And yeah, we have ectropion both eyes. So we know that that's a good code. All right. So and then it's a matter of the procedures. 67914. Yep. Ectropion suture. All right. Suture repair. All right. That's for our left eye. That's why we have E2, specifically the left lower eyelid, and then excision of the tarsal wedge. Okay. 67916, specifically, that is for the right lower eyelid. Okay. Right lower eyelid here, tarsal wedge excision. Spot on. So that's how we arrive at B. All right. Very good. Very good, Kiera. All right, guys. So you guys, I don't think you need a screenshot. So we're going to keep it moving. We're going to keep it moving. So here we go. All right, hold on. I'm still going through. Give me 1 second. I'm just going to pause my screen. I don't want to go through all those clicks. I want to get right to the next one, okay? Because you guys are doing an amazing job. All right, so there we go. All right, so we're going to do some more coding, but specifically to the spinal cord. All right, so we're going to keep it moving because, you know, I always tell you I want to give you the most bang for your buck. All right, so here we go, Miss Tiffany. We unpacking junk in the trunk. I might have to dust some stuff off. Here we go.
That's right, Miss Tamika, because we got plenty of it. We can dust more off. All right, coders, let's get to it. A, 62272. B, 62273. C, 62270 and 62273. D, 62270 and 62287. A 42-year-old patient returns to the hospital neurology clinic for follow-up. He was checked 3 days prior to his visit, where a lumbar puncture was done to find the etiology of the patient's headaches. The headaches have increased in intensity over the past 3 days. The neurologist examines the patient and finds a CSF leak from the lumbar puncture. A blood patch by epidural injection is performed to repair the leak. Code the services for today's visit. 2 minutes, coders.
Right. I think that most of you have gotten it in there. We still have a few more seconds. I didn't want to break in too soon because I feel almost like, when you have kids and you hate to wake them up because it looks like they're sleeping so well, but you have to. And I'm just like, I know they're working hard. I remember solving those scenarios. I'm like, wait. Let me get my answer in. So hey, I love it. There we go. All right. So I think I've seen everybody's answers in there. And hey, it's okay if you're not quite sure. That's okay. Again, that's why we're here. Always, we're gonna go back to these keywords. Don't let it overwhelm you or anything. All right. See, I knew you would. I knew you would. You just always just pulling my leg, Miss Susie. Just pulling my leg. All right. So here we go. We've got this 42-year-old. They're returning for this follow-up. All right. And then they had 3 days prior this lumbar puncture. That's important. Okay. The headaches, they've increased and now they've gone and the neurologist has looked and they have a CSF leak or cerebrospinal fluid leak from the lumbar puncture. And so a blood patch epidural injection has been performed to repair the leak. That's how we got to B. Most all of you got there. Some folks were teetering between B and C, and then with a little nudge, you got there. All right, so here we have this leak from the lumbar puncture, and they're having a blood patch by epidural injection. 62270. All right, this is spinal puncture lumbar diagnostic. All right, well, the lumbar puncture was performed, but it was performed 3 days prior. We are coding for today's visit. Okay, so remember, I always told you when I'm saying who, what, when, where, how, don't just breeze over it. When, okay, all of it's important. In this case, we need to hone in on when. Well, we're coding for today's visit, and this lumbar puncture was 3 days prior. Okay, so 62270. We're gonna get rid of that. right? So then we have 62272. This is spinal puncture therapeutic for drainage of cerebrospinal fluid, or CSF. Well, there is mention of the cerebrospinal fluid, but this is coding for the drainage of it. And in fact, this patient has a leak of it, and we're there to repair the the we are there to repair the drainage that is already happening. The CSF fluid is leaking from this puncture. Okay, so we're not there to drain it. It's already draining, and we don't need it to drain. We need to plug it up. All right, so we're going to get rid of 62272. So 62273, injection epidural of blood or clot patch. And even without all of that, because you know I'm always going to give y'all the backstory, just matching it up. None of the other codes have that verbiage in it about a blood or clot patch. All right. And we need that. What? We need that blood patch. Okay. So we know that here, like I said, the lumbar puncture was 3 days prior, and 62273 is your code. You know, I'm always going to give you a little backstory. This epidural blood patch is a surgical procedure that uses autologous blood in order to close one or many holes in the dura mater of the spinal cord. It's usually a result of a what? Previous lumbar puncture. All right, so we know we're spot on. All right, coders, you all are just doing outstanding. I'm going to give you one more. So let me, you know what, let me do this. So whenever you guys are like, Mr. Mickey, your screen isn't advanced, it's because I will pause it because I want to advance and then I forget. So let me get to something with a little bite in it. All right. And there we have it right there. Okay. So we're gonna do this one. All right. And if we have time, we'll pull out another one, but I want to be sure we get to this one. Okay. So pull out your knife and fork, dig in. All right, Miss Tiffany, you've got the floor.
That's right. Pull out your knives and fork because there's plenty to eat in this scenario, and I know you guys got this one. A, 63045 modify 50, 63048 modify 50. B, 63020 modify 50, 63035 modify 50, 63035 modify 50. C, 63015 modify 50. D, 63045, 63048 times 3. MRI reveals patient has cervical stenosis. It was determined he should undergo bilateral cervical laminotomy at the C3 through C6 infusion. The edges of the laminectomy were then cleaned up with a kerosene, and formatomies were done at C4, C5, and C6. The stenosis is central. The thoracotomy is performed by using a burr. Nerve root canals were freed by additional resections of the FAC, and compressions of the cervical cord was relieved by removal of a tissue overgrowth around the foramen. What CPT code should be used for this procedures? Encoders, you have 2 minutes.
I think they're ready. I think they're ready, Miss Tiffany. No, look here. Look here. These coders are knocking it out of the park. I'm loving this. And again, with just a little nudge for some of you that were teetering on some of them, then you got there. So all I need to do is be sure you're clear so that you can break the tie on your own when you're on that exam. You guys are doing phenomenal. I love the energy and the effort. So we're going to go ahead and take a look. This patient has cervical stenosis. They've determined that they should undergo a bilateral cervical laminectomy, C3 through C6. They're going to have a laminectomy for some foraminotomies that are going to be done at C4, 5, and 6. They have stenosis that's central, so they have a facetectomy that's been performed using a burr. They have nerve root canals that are freed by additional resection of the facet, and compression of the spinal cord has been relieved by removal of this tissue overgrowth from around the foramen. So this patient is having compression of the spinal cord. So by removing portions of the lamina and doing various things to the facet, they're removing those. They're going to free that nerve root from being pitched upon. Okay, so the answer is D, and you guys were rolling in there. All right, so we've got 63015. This is for a laminectomy. All right, yeah, we do have a laminectomy performed, but this is without a foraminotomy. We had several foraminotomies done. So we know that 63015, we're going to take that one away. All right. So automatically we're done with C. So we have 63020. This is for a laminotomy. And what did we have? A laminectomy. Okay. So again, being sure about what those key terms are and those medical terms in this case specifically. So we get rid of 63020, gone. All right, this gets us down to A and D. So we have 63045. All right, with this one, we have laminectomy. Yeah, that happened. A facetectomy. Yeah, okay. Resection of the facet. Okay, again, understanding what's happening. Okay, you see ectomy, you know that they are resecting something, removing something. They have the laminectomy, they have the facetectomy, and they have a foraminotomy as well. We have several of those. Okay, foramen. All right, so unilateral or bilateral. As soon as you read that, what does that tell you you could do? Even before we start getting into the multiplier with the 63048, but as soon as you read that, that's right, then you don't need the modifier 50, and a couple of you honed in on that. That's right, Rasha, Natalie, Shalini. Yeah, you don't need it. It's telling you if it's in the code language, and you know I'm always drilling that into you guys' heads when it comes to multipliers or even modifiers. If it's in the code language, then you don't need it. You use a modifier to explain something further about a code because it's not inherent to the code language. All right, so you can remember it like that too. So automatically, bilateral cervical laminectomy, we know that that happened, but the code language is taking care of it. So we don't need that 50. Boom, that's gone. So that pushes us to D. Okay, but in case you need to know about D, because the other thing is that 63048, it had the 50 modifier, but it also didn't have the multiplier that was needed because we need this code for each additional segment. And I know some of you were asking me before, when do you ever use a multiplier? Well, this is it. Okay, when it says each additional, that lets you know for every segment, be it in the cervical, thoracic, or lumbar area, we're going to need a code for that. All right, and so for this one, we had C3 through C6. That's 4 segments. Remember, your segments are the actual bones, not the disc space in between. Okay, so we have 3 more that we've got to code for because this right here, this takes care of the first one, and this is for each additional. All right, and that's how we got to D. How we doing, coders? Yeah, that's right, Shalini. You guys are just fantastic. I don't even know that you would even need a screenshot. Okay, we breezed through several scenarios today. All right, several scenarios. You guys know You guys are AMCI outstanding. All right, Natalie, was it 13? Because I was about to start counting, okay? So you guys, hey, loving it, loving it, loving it. So I'm always trying to get through at least a dozen. One day we might even get through 15, but I want to give you more than enough to cover. You're gonna see 10 with each of your sections, okay? So you guys know why we need that feedback. It's vitally important to AMCI to continue to deliver quality classes to you deserving students. I so appreciate you guys, okay? It helps me to help you as well as Miss Tiffany. We love helping you guys, okay? No feedback means no good. We want to hear from you guys. Thank you so much for hanging out with us today, okay? I always tell you, I am so humbled that you guys share 2 full hours of your precious time, because I always say you can earn money again. All right, but hey,